Hi, good morning. This is Sarah Watson. This is the first time I've ever done anything like this, so please bear with me. What I've gone ahead and done, I just want to illustrate that I do have notes per each slide. I'll go ahead and send you this PowerPoint presentation as well. But I think to make it a little bit more exciting for you as a viewer, I'll go ahead and put this in presentation mode, and I've gone ahead and printed off my notes. That way you can see the animated full effects and you're not just having to sit here and stare at my screen, which is what you're pretty much going to do anyway, but hopefully it makes it a tad bit more exciting for you. I went ahead and, let's see here. Trying so that it moves out of my way so I can play. Oh, here we go. Sorry for that. Okay, so I went ahead and chose option 1, Health Information Exchange, which I'll refer to from here on out as HIE. So what exactly is HIE? Well, healthcare professionals rely on accurate, adequately structured information to exchange and effectively manage patient care. HIE is defined as the use of information technology to support the electronic transfer of clinical information across healthcare organizations, and it continues to grow among those pursuing greater patient safety and healthcare accessibility and efficiency. As there is often a multidisciplinary team interchanging patient data, it is essential a collaborative, efficacious methodology is in place. Interest in health information exchange has become increasingly welcomed as a solution to multi-channel communication. The functionality of such systems offer benefits from a regional and local exchange standpoint and can offer advantages to population health management. Through continued analysis of HIE, the usefulness, value, and access can be improved to promote public health management. The following studies will offer insight into growing HIE adoption and options to grow patient safety and healthcare accessibility. So what exactly are the capabilities of HIE? HIE system initiatives are being implemented worldwide to consolidate patient information and facilitate communication amongst clinicians. The promise of cost and utilization reduction has healthcare institutions scrambling to implement HIE. The functionality of HIE may offer advances to patients, including more optimal health coverage and continuity of care. Harnessing the capabilities of an integrated system offers both patients and providers a comprehensive view of exchanged information and a more optimal progression and succession for patients seeking treatment from multiple facilities and specialists. Numerous terminologies and formats are present with healthcare documentation, and the HIE offers the capability for complex data to interface more sufficiently at potentially a lower cost. The convergence of increased HIE adoption and functionality will improve the design and support the infrastructure necessary for secure data transfer. Regionally and nationally, communication protocols are being established to determine the most optimal safety standards for timely, efficient, secure data exchange. There's been a lot of ongoing studies that look into HIE capabilities. HIE capabilities provide clinicians with an opportunity to be involved in providing insurance enrollment assistance, as has been previously established. Gold et al. Did a study in 2015 which suggested that building strategies for linking HIE to electronic health records to payers to improve synergy and potential coverage offered better rates and also continuity for the patients. Through capitalizing on the HIE functionality, an exchange of information between providers and patients can improve both clinician efforts to keep patients continuously covered. Not only can patients benefit from HIE adoption, but also pharmacies, labs, radiology facilities, payers, emergency management, first responders, and health departments can also reap the advantages associated with access to quality and shared information. So what exactly are these standards involved with HIE? Well, it's a rather large concept, as interchanging secure integrated data containing patient-sensitive material can be achieved through HIE. 11 typical cases were studied in which health information organizations, known as HIOs, and HIE was used to improve the efficiency and quality of health reporting, improved emergency response, facilitate public health investigation, and to interface public health data to the clinical community. As stated above, as I stated previously, it can help labs, it can help emergency rooms, but it also helps with mandated reporting. Mandated reporting via labs on notifiable diseases and conditions has also improved due to timeliness and efficiency of HIE, as well as public health quality monitoring for epidemics, chronic diseases, and public health alerting, which I think is great. Through utilization of HIE, manual reporting processes are replaced and provide stockholders within certain modalities to share data, both regionally as well as nationally. Health institutions and agencies can leverage the shared information to develop standards of care, follow health trends, and communicate constructively. So what are some challenges associated with this? Well, the viability of HIE is being studied to determine the benefits, requirements, and overall value add. Optimized HIE is essential in ensuring health data privacy and security in addition to adherence of federal and state regulations. Compliancy dictates partnership as servers needed to ensure the sharing of data related to treatment, payment, and healthcare operational activities is warranted. Engaging healthcare stakeholders, clinicians, and patients in creating an HIE system focused on value-based care and increased provider and patient benefit. Perhaps the largest factor impacting the adoption of widespread HIE is patient support and endorsement as consumers drive HIE utilization. Through gathering and analyzing data of 23 focus groups via surveys and follow-up meetings, uncover the need for a model that provides a framework for a nationwide network of HIE that is consumer permission driven and financially sustainable. The data collected via this study from all of these surveys offered insight into concerns, challenges, and benefits for 12 healthcare stakeholders serving a United States area of 1.3 million people. Although key themes were identified, suggesting the overall use of HIE was promising, there are a number of challenges which will need to be further identified and overcome to achieve optimal coverage. Clearly, there are still quite a few significant challenges associated with HIE, and it's essential that additional data is collected and that we continue to forge ahead when attempting to overcome these challenges. So what are some participation barriers? Well, in an attempt to facilitate HIE adoption, clinicians are subjected to continued education and pressure from healthcare institutions to ensure compliance and integration. Studies conducted to determine healthcare provider perspectives are underway to uncover potential barriers to utilization of local exchanges. In addition, healthcare consumers must be willing to participate in HIE as their view and stance on it must be evaluated to determine the model viability. Public support is crucial to long-term sustainability as consumers must be willing to allow the transfer of their data as breaches between servers may occur. In addition, the complexity of EHR implementation can be far more challenging for some institutions, not only because of the large scale, but also due to the varying degrees of policies that kind of vary among states, insurance companies, as well as patient data. There was a study conducted by Cochrane et al. Back in 2015, which surveyed 5,618 healthcare perspectives on HIE and found that the number one thing that they were mostly concerned with had to do with quality training, the cost, and just the overall integration of HIE. These should be considered a top priority for slow adapter institutions. Also, data collected via telephone surveys of 800 New York residents by Cornell University showed strong support in favor of HIE as a way to improve the quality of care and gain access to HIE data without the need for consent in emergency situations. Although privacy and security were concerns, exchange of information to promote effective communications amongst clinicians did receive support. So what are some recommendations as far as how we move forward with HIE? Well, as suggested, research needs to be at the forefront. Research for HIE has been conducted on a small scale and needs further evaluation to meet often limited evaluation objections. Strategies for higher quality scientific evidence and direction for implementation must be established. Opportunities for fundamental practical Practical implications can offer policymakers and potential HIE organizers insight into approaches for widespread implementation of HIE. Through the development of IT evaluation metrics, as well as awareness of state law and regulations, HIE will conform to technical standards. Furthermore, additional education awareness of the benefits of healthcare information delivery systems could prove to be advantageous in alleviating concerns of consumers. Lastly, well-planned implementation, created using a flexible timeline while utilizing an advisory board that is communicated with stockholders, will prove to be useful to ensure compliance, reduce errors, maintain security, as well as economic value proposition. So the conclusion, while there's still a great deal of research that needs to be conducted, the paradigm for how electronic health records are stored, managed, and shared continues to shift. As technology advances and the healthcare sector becomes increasingly regulated, health institutions, providers, and patients will need to adapt to maintain solvency. Through widespread adoption of HIE, the integration of sustainable workflow with comprehensive patient data will offer clinicians solutions to inclusive patient information and a better care experience. Increasing investments and nationwide mandates on implementing HIE, coupled with growing the need to reduce costs, are factors in the use of application programming interfaces. Further exploration of the functionality of HIE and the medical device connectivity market at both the regional and local exchanges will provide benefits to population health management, accessibility, and efficiency. And there are my references for this. I'd like to thank you for sitting here and listening to me talk about HIE. I hope that you found some parts of this presentation beneficial. I will go ahead and send this over to you. Have a great week. Thank you.